You just finished peeing, zipped up, turned to walk away, and then that dreaded feeling hits dampness. Again, what if that tiny leak isn't just age, but the first warning sign that your bladder is slipping out of your control? Permanently. The truth: over 50% of men over 60 experience urine dribble, yet almost no one talks about it. And worse, far too many are rushed into surgeries or medications they might not even need. But there's good news. This video will walk you through a natural, science backed path to regain control without pills, without surgery, and without giving up your dignity. All it takes is the right knowledge and a few consistent habits. Feel free to share your age or your year of birth and where you're watching from. We truly value getting to know our viewers better so we can continue bringing you meaningful insights and practical tools to support your well being every day. And if you found today's message helpful, don't forget to subscribe so you never miss out on the kind of content that helps you live healthier, longer, one day at a time. Now, let's get started. You just finished peeing. You zipped up, walked away. But a few steps later, there it is again. Wetness. Not a full accident, not enough to cause alarm, but enough to make you uncomfortable, anxious, and ashamed. Have you ever walked out of the bathroom only to find yourself turning around minutes later? Like your bladder didn't get the message the first time. It's frustrating. But more than that, it's a warning. So, what's really going on down there? Why does your body feel like it's no longer listening to you? Let's break this down simply. The prostate sits directly around your urethra, the tube that carries urine from your bladder out of your body. As men age, this gland naturally grows, and when it does, it tightens around the urethra like a hand gripping a garden hose. When that happens, urine doesn't flow freely anymore. Some gets stuck behind. Even when you feel like you've emptied completely, a small pool of urine remains trapped. That leftover fluid, it's what leaks out moments later, staining your underwear, your pants, and slowly not your confidence. This explains why one of the most common complaints men over 60 have is that they wake up multiple times at night just to pee and yet never feel quite finished. Many describe needing to push or strain just to feel relief. And some have stopped wearing their favorite light colored pants altogether, afraid of a visible spot they can't control. There's also the shame, the dampness, the smell, the worry that someone might notice. So you avoid long drives, social gatherings, even intimacy. And slowly your life begins to shrink just because your prostate didn't stop growing. But here's where it gets serious. Experts warn that mild urine dribble can escalate fast. Within 12 to 24 months, what starts as a few drops can become full-blown incontinence. Imagine not being able to predict when you'll leak, not being able to stop it. Imagine needing to carry extra underwear or wearing adult diapers every single day. And here's the hard truth: once your body reaches that point, reversing it becomes exponentially harder. Yet most men do nothing because they fall into the same traps over and over. This is just part of getting older. I'll talk to a doctor if it gets worse. Maybe it'll go away on its own. Let's be clear, it won't. In fact, the longer you wait, the less effective the natural options become. Your bladder weakens, the muscles around your pelvis tighten or give out, and your sense of control fades. But what if the real cause isn't age? What if the real reason this keeps happening is a set of daily habits? Things you didn't even realize were hurting you. Because if the problem isn't just age, then the solution doesn't have to be surgery or medication. It can be you. That means there's still time. And that's where we go next. Let's talk about what most men are told to do once the problem becomes too much. You start with pills, and if those don't work or stop working, surgery is next. Sounds straightforward, right? But what if those quick fixes aren't really solutions? What if they're just shortcuts to a new set of problems? There are three common procedures most urologists recommend: TURP, green light laser, and resume therapy. TURP removes part of the prostate via a scope. Green light uses high-intensity lasers to vaporize tissue. Resume injects steam to destroy the extra tissue from the inside out. These are invasive. They physically alter the structure of your prostate in order to relieve pressure on the urethra. In many cases, symptoms improve quickly. But there's a catch, and it's bigger than you think. Clinical data shows that between 20% to 60% of men experience erectile dysfunction after TURP or laser surgery, depending on age and health. And up to 30% develop temporary urinary incontinence, meaning they literally can't hold their urine and need to wear protective underwear or adult diapers for weeks or months. Other risks include long-term bleeding, chronic urinary tract infections, and bladder spasms that are hard to manage. What doctors often don't emphasize enough is that recovery isn't just physical, it's emotional. For many men, losing control, even temporarily, leads to anxiety, shame, and withdrawal from their normal lives. You're promised relief from leaking, but you're not told that you might have to live in a diaper for 90 days after the procedure. You expect to return to normal, but the truth is the post-surgery body doesn't always function the way it used to. And many men say, I wish I had known this before. I would have tried everything else first. Then there's the medication route. Alpha blockers like tamsulosin, also known as Flomax, are often the first thing prescribed. They work by relaxing the muscles around the prostate to make urination easier. And yes, they can help in the short term, but they don't stop the prostate from growing. And they come with side effects, lightheadedness, low blood pressure, fatigue, and perhaps most concerning, retrograde ejaculation, where semen travels backward into the bladder instead of out through the penis, disrupting both fertility and sensation. Even worse, these meds can become a crutch. Without changing your diet, lifestyle, and pelvic muscle function, their effectiveness fades over time, leaving you stuck in a cycle of increasing doses and mounting frustration. So, ask yourself this: do you want short term relief followed by new complications, or do you want long term control that comes from understanding and transforming the root cause? Here's the silver lining: most men who undergo surgery say they wish someone had shown them a natural evidence based plan before it got that far. That plan exists, it's real, but it requires something no pill or laser can give you: your active participation. You still have time. And if you start now, you may never need the surgery. That's not a sales pitch, that's a fact. So let's explore the 6 natural strategies that can help you regain control without medication, without surgery, and without losing another day of confidence. I'm ready. No pill can replace the power of what you do every single day. And when it comes to regaining control over your bladder, you don't need to wait for surgery or a prescription. You can start today with 6 simple but powerful strategies that have helped thousands of men reverse the symptoms of prostate-related leakage without touching a single drug. Let's begin with the first one: something you can do during your very next bathroom visit. Strategy 1: the double void. Train your bladder to empty completely. If your prostate has grown larger with age, it may be pressing against your urethra, preventing urine from flowing out fully. What happens is that you finish urinating, but a small reservoir remains trapped. A few minutes later, when you shift your position or stand up, that leftover urine dribbles out. Here's where the double void comes in. By waiting 30 to 60 seconds after you've just peed, taking a few deep breaths, and giving your pelvic muscles a chance to relax, you allow your bladder to reposition and prepare for a second, more complete release. Try changing your stance. If you usually stand sit down, then gently attempt a second urination. Yeah, second, even if it's just a few drops, you're clearing what would otherwise end up in your underwear. One man said, I used to change my underwear twice a day from that wet feeling. 2 weeks into doing the double void, I didn't need to anymore. After just a couple weeks, men often report fewer accidents, less urgency, and above all, a renewed sense of control during one of the most basic human functions. Strategy 2: Kegel training. Wake up the muscles that keep you dry. The pelvic floor is a group of muscles responsible for bladder and prostate control. Over time, especially with a sedentary lifestyle, those muscles weaken. When they stop firing correctly, the result is leakage and poor stream control. Kegels, when done properly, are the most direct way to reactivate those muscles, but they must be done right. No tightening the abs, no holding your breath. Here's how: lie on your back with knees bent, feet flat. Now imagine you're trying to stop a stream of urine. That's the muscle you're looking for. Gently contract and hold for 3 seconds while breathing steadily, then relax. Do 10 reps, 3 sets, every night. That's 5 minutes before bed. One man who swore off exercise said, I figured what could 5 minutes hurt. A month later, my urine stream was stronger and I stopped leaking during the day. After 3 to 4 weeks of consistent training, men report not only more confident trips to the bathroom, but also uninterrupted sleep. No more getting up at 2 or 3 a.m. to trickle out a few drops. Strategy 3: stretch the pelvic floor. Release what's been tensed for years. Now here's something most men never hear about: Your pelvic floor isn't always weak, it might be tight. Especially if you sit a lot, your pelvic muscles can become chronically tense, losing flexibility and function. This tension can mimic weakness, leading to these same frustrating symptoms. That's why targeted stretching can be a game changer. Each night, take 5–10 minutes to open and release that tension. Start with the happy baby pose. Lie on your back, bring your knees toward your chest, and gently hold your shins or ankles. Breathe deeply, or try the child's pose, kneeling and leaning forward, stretching your spine while relaxing your belly. If mobility is an issue, sit on a firm chair and place a soft ball under your perineum. Let your weight sink in. At first, it may feel strange, even silly. One man joked, "I felt ridiculous lying like that on the floor, but after 3 nights, I was going to the bathroom and not dripping afterward." Within 2 to 3 weeks, most men notice a clear difference. They empty more fully, feel less pressure in the lower pelvis, and no longer need to force or strain to urinate. So far, we've focused on retraining your body to release more fully and regain muscular control. But if we stop there, we miss something deeper. The silent inflammation inside your body that's feeding the problem from the inside out. Let's now talk about what you're putting into your body every day, often without realizing it, and how it quietly fuels prostate growth and bladder irritation. Strategy 4: anti-inflammatory eating. Cut off the source of the fire. Chronic inflammation is a hidden driver behind prostate enlargement, and what you eat can either pour gasoline on the fire or help extinguish it. Sugary treats, ultra-processed dairy, and fast food may seem harmless in small amounts, but they ignite low-grade inflammation that builds up over time. Your body doesn't scream, it whispers. That whisper becomes frequent urination, a swollen belly, and nighttime bathroom trips. The fix begins with one word: subtraction. Remove added sugar from your daily diet, not just sweets, but also sauces, packaged juices, flavored yogurts, and low-fat snacks. Replace them with dark leafy greens, omega-3s from fatty fish or flax seeds, and plenty of filtered water. Try this for just 3 days, cut out added sugar completely, and keep a journal of how you feel. One man told me, "I thought I'd never survive without dessert. But after a week without sugar, I was shocked. I stopped waking up 3 times a night just to pee." In as little as 2 weeks, men report fewer nighttime trips to the bathroom, less bloating in the lower belly, clearer skin, and deeper, more refreshing sleep. You don't need to overhaul your life. Just start with what's on your plate. Strategy 5: reduce caffeine and bladder irritating drinks. You might love your morning coffee, and that's okay, but caffeine is a known bladder stimulant. It tells your bladder to contract, sometimes too forcefully, even when it's not full. The result: urgency dribbling, and that can't hold it, feeling that sneaks up on you in public places. And don't be fooled, decaf still contains caffeine. So does dark tea soda and so-called energy drinks. Even sparkling water can irritate sensitive bladders because of its acidity. Here's the compromise: keep your 1 cup of coffee, but have it before 10 a.m. Cut off all caffeine by 2 p.m. Stick to still water or calming herbal teas like chamomile or rooibos for the rest of the day. One patient said to me, "I thought coffee was keeping me sharp. Turns out it was making me leak like a faulty faucet." Within just a week or two of cutting back, many men find they no longer wake up at night with sudden urges. Daytime urgency fades. Even reflux and sleep quality improve. And no, you won't lose your energy, you'll reclaim it. Strategy 6: full body movement. Reclaim your command center. Now, let's move beyond the bladder and prostate to the entire system that surrounds it. Belly fat isn't just about appearance. It pushes downward, placing pressure on your pelvic region and squashing the urethra. This mechanical stress worsens both flow and control. But that's not all. A sedentary body accumulates inflammation, loses hormonal balance, and disconnects the nerve pathways that allow you to control urination naturally. Exercise doesn't have to mean a gym membership or heavy weights. Just 5 sessions per week, 3 of light aerobic movement, like brisk, walking, swimming, or cycling for 30 minutes, and 2 body weight routines at home, using squats, bridges, and planks. What matters most: focus on activating your hips and pelvis. Don't just move with intention. One man shared, "After losing 9 pounds off my gut, I went from 3 bathroom trips a night to just 1. The leak stopped. I finally felt like myself again. After 3 to 4 weeks, men report stronger urine streams, less residual dribble, better mobility, and a surge in confidence they hadn't felt in years. So, no, none of these are magic bullets. But each action is a step away from the silence and shame of leaking in public or sleeping with pads. It's a step back toward dignity, freedom, and strength. And the best part, you don't have to wait for anyone to give you permission. You can choose one of these strategies today, right now. Track how you feel after just 7 days. Most men are surprised not by how hard it is, but by how quickly their body starts responding once they stop ignoring it. Because the real reason you haven't changed yet isn't that you can't. It's that you haven't truly believed there's a way forward. But there is, and it begins with your next choice. You've heard the strategies, you understand the science, and maybe right now you're thinking what so many men have quietly thought before I know I should exercise. I know I should eat better, but why haven't I started? Let's be honest, it's not laziness, it's not lack of knowledge or time. The real reason, deep down, you've stopped believing that you can take back control of your body. You've lived with the symptoms so long, they've started to feel normal. You've tried things before, maybe pills, appointments, even a procedure, and nothing seemed to change. So now, to avoid another disappointment, you tell yourself it's fine. You tell yourself it's not that bad. But every time you change your underwear in the middle of the day, every time you look at a diaper in the bathroom drawer, a part of you still hopes there's more to life than managing leaks and hiding symptoms. Let me tell you about someone, Jackson. He's 67. For years, he didn't leave his house for more than 30 minutes. Not because he didn't want to, but because he couldn't trust his bladder. He wore adult diapers every single day. He stopped sleeping next to his wife because he was embarrassed to wake her up 5 times a night. He turned down invitations. He sat out of family trips. He felt like a shell of the man he once was. Then one night, after changing for the second time in the evening, something shifted. He didn't set a giant goal. He didn't wait for motivation. He just decided to try 2 small things, double voiding every time he used the bathroom and doing 5 minutes of Kegels before bed. That's it. In 2 weeks, he noticed fewer leaks. In 4 weeks, he slept through the night without waking up drenched or anxious. In 8 weeks, he stopped using daytime pads. He booked a trip with his wife for the first time in years. And when I asked him what changed most, he didn't say, my bladder. He said, I don't feel like a patient anymore. I feel like a man who's back in charge. Because that's what this is really about. It's not just about urine. It's about control. And it's about how you see yourself. Jackson didn't wait for a miracle from outside. He rebuilt his inner control system from the inside out. That's the shift from waiting to doing, from relying on prescriptions to trusting your own actions, from hiding in shame to standing in ownership, from feeling stuck to becoming free. So ask yourself honestly, what's scarier? Starting today, even if it's uncomfortable, or living the rest of your life waiting for a body that no longer listens to you. You don't need to change everything at once. You don't have to be perfect, but if you choose just one thing, just one of the strategies we've talked about, you begin restoring the most powerful asset you've lost belief, not just in your body, but in yourself. No one else can start this journey for you. But the moment you do, you'll stop seeing yourself as someone who's suffering and start seeing the man who's finally making his way back. So where do you go from here? Let's bring it back to the 6 natural strategies we covered today. Simple science-backed steps that can shift your life without a single prescription. First, double voiding learning to empty your bladder fully each time. Second, doing proper Kegels to reawaken your pelvic control. Third, gently stretching tight pelvic floor muscles that have been silently holding tension for years. Fourth, reducing inflammation with smarter food choices. Fifth, cutting back on caffeine and bladder irritants. And sixth, whole body movement to reclaim strength and control. But here's the truth. You don't need to do all 6 today. You just need to pick one. Let's make it even simpler. The next time you go to the bathroom, try this after you're done. Pause. Take a deep breath. Sit down if you were standing. Wait for 30 seconds. then try to go again. That's double voiding. That's one small act of reclaiming your power. If you do this once tonight and again tomorrow, you've already started. You've taken the first step away from dependence, from anxiety, from those late night wake ups. And most importantly, you've taken a step toward believing in yourself again because you don't have to accept a life of leaks, shame, or surgeries. There is a path forward, and it starts with you. How did today's message resonate with you? Did anything make you reflect more deeply on how you're taking care of yourself right now? We'd love to hear your thoughts. If you feel comfortable, let us know what decade you were born in and where you're watching from in the comments below. Your story matters not just to us, but to every man out there who thinks he's going through this alone. And if you found today's insights helpful, don't forget to subscribe so you never miss the kind of content that helps you live healthier, longer, one step at a time. We'll be right here with you, ready when you are.